Welcome to Community Health Heroes, where we spotlight local leaders and organizations that provide much-needed health and wellness resources and information. Our hope is for everyone in our community to strive to live healthier, happier, and longer lives. I'm your host, Leslie Snedowski. Thank you for joining us. Today on Community Health Heroes, we'll be speaking with Sophia Thomas, DNP, a family nurse practitioner specializing in pediatrics with the Daughters of Charity Services of New Orleans. She has some important information about what every parent and student needs to know about getting ready to go back to school. We also spoke with Dr. George Ellis Jr., who is the Director of Pediatric Ophthalmology at Children's Hospital. He explains why it's important to get your kids' eyes checked out before classes begin in our Community Health Heroes report. Greater New Orleans Vice President of the American Heart Association, Brittany, will also be stopping by to talk about the Red Sofa Tour, a grassroots campaign designed to spark conversation on heart disease, which is the #1 killer of women in our community. And joining us for today's Eat Fit NOLA cooking segment, we'll be in the kitchen with Mallory Broussard from Whole Foods and Eat Fit Ambassador Emily Eickhoff, who will prepare sweet potatoes with greens and beans and show us more healthy back-to-school meals you can easily prepare for your kids to eat at home and at school. So don't go away. We'll be right back with more Community Health Heroes.
When I was 6, my mom had a stroke.
I'm Paul George. Learn the signs of a stroke fast.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Spot a stroke fast.
Welcome back to Community Health Heroes. Did you know that more than 80 million students in the United States, from pre-K to college, are preparing to go back to school in August? With us to discuss important back-to-school health topics is Sophia Thomas, DNP, with the Daughters of Charity Services of New Orleans. Thank you so much for joining us today, Sophia.
Thank you for having me. I'm looking forward to our conversation.
Let's start with going to the doctor. Should kids get a back-to-school physical every year? And if so, what should those appointments include?
Kids should get a back-to-school physical. The physical should entail a lot of different things, including immunizations. Parents need to be sure that their children are up to date on all their immunizations, but the physical should also include screenings for vision problems, hearing problems, anemia, developmental issues that children may get, screening may miss in other areas. Parents oftentimes are sure that their children are up to date on immunizations by going to these off-site immunization places like the shot bus. But what is missed in those encounters as compared to a regular physical exam are the growth and developmental issues that are so important to children.
I remember on the first day of school, we'd always get checked for lice. Does that still happen? And what happens if your kid does have lice and gets sent home? What do you do?
Well, it doesn't happen in every school, but periodically there are screenings. And unfortunately, if your child gets sent home from school, you should obviously check the child's hair for any signs of little bugs or nits, which are little white specks that appear close to on the hair shaft, close to the skull. And then there are a lot of over-the-counter preparations that can be purchased to help get rid of the lice. It's important to follow the instructions on those packages explicitly, because if the products aren't used correctly, the lice will come back.
Oh, I remember it was such a stigma when the first day of school when everyone had their heads checked. It was really creepy.
Yeah, exactly. The nurse with the little sticks going through your hair. So I remember that very clearly.
Well, let's talk about backpack safety. Those things can get super, super heavy. What type of backpacks do you recommend, and what can parents do to help their kids lighten their load?
It's important to get a backpack that fits correctly on the child's back. It shouldn't sag too low above the buttocks. It should really be a mid-back. The strap should cover both shoulders, and they should be wide and padded. Some of those thin straps can really cut into the circulation in the child's shoulders, and that it can cause blood and nerve problems. The backpack really shouldn't be any more than about 10 to 15% of the child's body weight when full. So if you have an 80-pound child, that's about a 10 to 12-pound weight on the back. And if you think about the weight of some of these books, that's a lot. Some things that parents can do, and what I've done for my children is, if the kids forget to bring their books home, you could always or you could always purchase a book online at Amazon for $2 or $3, the same book that the child uses in the classroom. So that way, if they forget the book, you have the book at home, but also they can leave the book at home, and that alleviates some of the weight in the backpack. They should always wear the backpack on 2 shoulders, not just one, because that altered posture can really cause chronic back problems. And again, a backpack that's too heavy will also cause chronic back problems.
A big problem that exists in school, unfortunately, is bullying. Never changes. What type of mental health resources are available nowadays if your kid's getting picked on in school?
Well, lots of schools are aware of the bullying problem, and teachers and principals are trained to act on that. It's important that if your child is bullied, that they feel comfortable in communicating that to you. And children need to know things like if a bully says something, stand up and say, now why are you going to say something like that? Just to really put the pressure back on the bully, but also there are counselors at school that are very helpful. So if the child has problems, encourage them to speak to somebody at the school. Parents should make communication with the school as well to say, Johnny's been bullied by Susie, could you please look into this? And it's important to do this with an email or text message rather than just a phone call. That way you have documentation that this has been an ongoing problem.
Let's switch gears and talk about sports. All kids love sports, but sometimes kids might have a pre-existing condition. What's your responsibility as a parent? What do you tell and who do you tell?
Well, most children now that play sports in Louisiana have to have the Louisiana High School Athletic Association form completed, and that gives a pretty good health history as well as alerts medical providers for any possible complications. It's important that when the parents have those forms filled out by their provider, that they provide all the accurate information about family medical history and the child's health history as well. So that way the medical provider can provide an accurate assessment to clear the child for school. Certainly if the healthcare provider is not notified of a possible healthcare problem, then that could lead to complications on the field.
Yeah. Well, I want to talk about screen time. Between phones, computers, TVs, and tablets, there's a lot of screen time that these kids are exposed to. What do you recommend about limiting screen time? How much screen time should kids be allowed? And about sleep, how many hours should kids sleep a night?
Well, the American Academy of Pediatrics recommends for especially young children that they limit their screen time to no more than an hour a day. You know, when we were kids, we were outside playing all the time. Now we have such a problem with childhood obesity. A lot of the kids have the iPads and computer work and assignments are done on the computer, so we need to factor that in. Certainly they need to have ample time to do their schoolwork, but we do need to allow some leisure time on the computer or watching TV as well. So each child's recommendation will really be individualized. And as far as sleep goes, the younger children need obviously more sleep than the older children. Younger children need about 10 to 12 hours of sleep, but still the older children need about 8 to 9 hours of sleep at night. When you talk about a teenager requiring that much sleep, they often go to bed late because they're on their phone or they're on their computer watching TV, and then they're having to wake up earlier because they start school earlier. So it's important to recognize that these kids do need to have an earlier bedtime, and that really should be enforced. And bedtime needs to be with the TV off.
What happens if your child has allergies? Who do you tell about allergy issues, and how can you ensure that your kid's going to be safe at school?
Well, most schools actually have a form that can be completed by the healthcare provider. The parent can get the form from the school, bring it to the healthcare provider's office that explains what the allergies are, what some suggested alternative foods would be. For example, if the child is allergic to fish, a substitute might be chicken, things like that. But as long as the school is notified in writing of the child's allergy, the schools have been very, very good and responsible at altering the child's diet in the school lunch to make those accommodations. Certainly if your child has a life-threatening allergy, it's very important that if your medical provider recommends an EpiPen for allergic reactions, that you get that EpiPen, get the prescription filled with the child's name on it, and bring that to the school so it's readily available.
Childhood obesity is a very big problem in school, and a lot of kids are faced with making their own choices at lunch. What recommendations would you give for healthy lunches and snacks, and what can parents do to kind of get their kids to go in that direction?
Well, kids are going to be kids, but in saying that, making the right foods available will help make the correct choices. So healthier living at home means they'll make healthier choices away from home. We hope The school lunches that are provided today actually are analyzed nutritionally and actually do try to cut out some of the calories, some of the sugars and things like that. What I always tell my patients is that generally white foods are bad for us. So you talk about sugar, salt, flour, fat. The fat in our meat is white.
All the good stuff, huh?
All the good stuff. Everything that tastes really good is actually bad for us. So if you choose things that have brighter colors, you're more likely to make healthier choices. Kids like fun things, and you can make roll-ups with ham and cheese in a tortilla shell and cut them into little pinwheels, and that's fun for them. So you have to be creative if you're sending lunch to school. But of course, healthier choices start at home. So if the family is eating healthier, the child will make healthier choices. And if you send your child to school with money to go to the vending machine, it would be nice if the school could provide healthier options in the vending machines as well.
I know it's a really busy time of year for you, so thank you so much for stopping by. If our viewers need some more information, how can they get in touch with you?
Oh, we'd love to hear from them. Our website is www.dcsno.org. That's the Daughters of Charity New Orleans website. And our office phone number is 504-468-4437, and we'd love to see the kids.
Well, thank you again for joining us.
Thank you for having me. I appreciate it.
If you want to double check when school starts for your student, you'll find the Orleans Parish First Day of School list on our Facebook page and our website at communityhealthheroes.org. When we return, we'll have a Community Health Heroes report on eye health for kids, and you may notice that our set is going to look a little different. We'll be right back with more Community Health Heroes.
It takes less than 1 minute to find out if you may have prediabetes, and you can do it here. So what are you waiting for? Just go to the site.
Welcome back to Community Health Heroes. Did you know pink eye is one of the most common and treatable eye conditions in children and adults, and about 3 million cases of pink eye occur in the United States each year? In recognition of Children's Eye Health and Safety Month, I got the chance to look in on Dr. George Ellis Jr., Director of Pediatric Ophthalmology at Children's Hospital, in this Community Health Heroes report. Ella is 3 years old, and she's about to start preschool. Dr. George Ellis Jr., Director of Ophthalmology Education and Pediatric Ophthalmology at Children's Hospital in New Orleans, sees more than 5,000 young patients a year. He said parents should start bringing in their kids for an eye exam at around Ella's age, and then schedule annual screenings at their pediatrician's office.
Kids will come in and they're a little frightened, and we try and make it a fun experience for them. And at the same time, when we can put up the right prescription in front of their eyes and suddenly they can see things, it's like magic. When they get to the classroom, if the teachers are trying to keep them near the back of the class, but they're always wanting to get to the front to be able to see what's happening, that's a pretty good indication that they should get their eyes checked.
From his offices at Children's Hospital at 200 Henry Clay Avenue, Dr. Ellis, who's also the president of the Louisiana Academy of Eye Physicians and Surgeons, said vision problems are often discovered when kids go back to school.
About half the kids that come in having failed the school screening want glasses and don't need glasses. They think they look cool. So they're just wanting to have a frame because Susie or Johnny in the classroom got a pair of glasses and they want a pair of glasses too. So we have more time talking kids out of glasses than we do into glasses, which is kind of a change in what, we grew up with. At least what I grew up with.
At Children's Hospital's Eye Center, Dr. Ellis said some parents prefer to get their kids contact lenses.
It's not successful unless the child himself wants the contact lens and is willing to learn how to put them in, take them out, and take care of them. And we've had kids that were 6 and 8 years old that can do that, and we have others that are 18 and 20 years old that cannot do that. So it's not an age, it's a maturity level, and the families kind of know. A child won't brush his teeth. I doubt they're going to take their contact lenses in and out. It's not safe to sleep in them at night. Even though there are contacts that are approved for sleep, in a child, they don't understand when there are problems, and so I just don't recommend children sleep in their contact lenses.
Dr. Ellis said parents should bring their grade school kids in for a checkup on a regular basis because a child's vision can change in a blink of an eye.
We'll tell them about the growth of the eye and what kind of glasses or prescription the child needs and why, and what it makes a difference for. Some of it has to do with whether or not it affects their development or just their functionality. So at the age range that we're talking about, up to about 7 or 9 years old, not only do kids need to be able to see clearly for functioning reasons, but also for the development of their visual system. Medical problems for children in their eyes, not just do they need glasses, but medical problems occur in about 4% of the population. And so that's where these baseline exams and the screenings can also help to find some of those medical issues like lazy eye or droopy eyelids or poor vision from lack of use, those kinds of things. Those are important. And when you're young, you can treat that. And when you get over about 9 or 10, it's too late.
For more information, go to chnola.org.
Hart, what's going on?
I'm leaving.
Why? What did I do?
Not enough. The pressure's too much. I quit.
I get it. I can do better. Just please don't leave.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
Did you know heart disease is the #1 killer of women in our community? And cardiovascular diseases kill approximately 1 woman every minute? And do you notice something different about our set? We're now sitting on a red sofa, and it's a sofa with a heart. Joining us now is Brittany Gay, the Vice President of the American Heart Association, to tell us more about the Red Sofa Tour. So welcome, Brittany, and thank you for bringing this guy.
Thank you for having me.
Tell me a little about the Red Sofa Tour, because those statistics are pretty startling. How will this guy spread awareness?
Absolutely. The Greater New Orleans Area American Heart Association is partnering with BHP to bring the Red Sofa Tour throughout many different stops throughout the Greater New Orleans area in an effort to really engage the public to spread awareness that cardiovascular disease is the #1 killer of women in our city, in our state, and in our whole country.
Wow. Tell me about the New Orleans locations, though. Where can people find the sofa?
Sure. Well, we're kicking off our first stop on Thursday night at the Baby Cakes game. We're very excited about it. And then from there, we'll be making stops once a month at various places throughout the Greater New Orleans area. So I encourage everyone to be on the lookout, and because you never know where it might pop up.
Now, when people see this sofa, I mean, they're not supposed to just look at it. They're supposed to sit on it, take a selfie. Tell me about that.
Absolutely. It's a fun and engaging way. This sofa will have a survivor gallery that accompanies it. The purpose of that is to put a face to some of those startling statistics that you mentioned earlier. We want people to know and understand what their risk factors are so that they can take proper actions to get preventative care. I know that what you're all about is raising awareness, and so part of what this couch is doing is engaging the public in the various locations that we have chosen to raise awareness. We encourage people to sit on the couch, snap a selfie, and then post it to social media so that they can then spread awareness through their contact group, and then hopefully the awareness of cardiovascular disease will spread throughout the whole New Orleans area.
Now, the American Heart Association Heart Walk is coming up. Tell us a little about that, and who's the chair this year?
Sure. We are super excited. We have been working very diligently with Joe Acapinti from United Healthcare to reach our goals for the New Orleans Heart Walk. It'll be Saturday, November 11th at Champion Square. So I encourage everyone to register at neworleansheartwalk.org and come on out. It's a great day of fun and physical activity for the whole family.
And how can people participate in both the tour and the Heart Walk? You mentioned a website, but you just come to the game and that's where you take your selfies, is that right?
So we'll be at the Baby Cakes game on Thursday, but other than that, you can visit the American Heart Association's Facebook page. It's facebook.com/AHA New Orleans, and follow the hashtag Red Sofa Tour. So that should be all the information there.
Thank you again for joining us today and bringing your red sofa.
Thank you so much for having me.
It's really been very comfortable sitting here. When we return, Mallory Broussard from Whole Foods and Eat Fit NOLA Ambassador Emily Eickhoff will prepare a healthy back-to-school meal for us. So stay tuned for more Community Health Heroes.
Hi, I'm Molly Kimball, registered dietitian with Oxnard Fitness Center and with Eat Fit NOLA. We're a nonprofit initiative that works with local restaurants to highlight the better for you items right there on the menus. We now have over 180 partners, and that spans over 5 regions. So the Oxnard Eat Fit program has expanded beyond Eat Fit NOLA to Eat Fit Bayou, Eat Fit BR, Eat Fit North Shore, and beyond. We're honored that United Health Foundation and Community Health Heroes features Oxnard's Eat Fit program every month, shining a spotlight on one of our talented Eat Fit chefs, whipping up dishes for you that are nutritious and delicious. So don't go away. Community Health Heroes will be right back.
Welcome back, and it's really starting to smell very good in here. Joining us in the kitchen are Mallory Broussard with Whole Foods Market and Eat Fit NOLA Ambassador Emily Eickhoff. Welcome to the show, ladies.
Hi, thank you.
Thank you so much for having us on.
Well, as you know, it's back to school time, but it's the parents that need to do a little homework, figuring out what healthy meals and snacks they should prepare for their kids. So tell us a little about what you're preparing today.
Today we're making a collard green, a zucchini bean, and sweet potato kind of mixed salad. So it's really easy to make, 8 simple ingredients. It lasts up to 4 to 5 days, so it's good to make ahead of the week so kids can have it all week long.
Gotcha. So tell me a little about what's in it. Show us the pretty ingredients up there.
Sure. Well, we have a couple of the plant-based foods. We have some green onions, we've got sweet potatoes, we've got zucchini red beans, which are a great source of high fiber and high protein. It's a really good low-fat option. And then we also have some roasted sunflower seeds, which is a great healthy fat option to include in your kids' meal.
Gotcha. And in terms of like calories or protein, fat, do you have any sort of breakdown on this dish?
Yeah. So per serving, it's about 400 calories, which is a substantial amount for, especially for a kid. For an adult, it's a little bit less than we recommend, so maybe as like an appetizer or a snack. But as Mallory was saying, super high in fiber. Almost 75% of your total recommended fiber is in this dish for the day, and a lot of protein. Barely any kind of fats or cholesterol, any of the bad stuff, not really in there. So you can tell by the bright, vibrant colors how amazing it is, really.
So I'm sure through trial and error you figured out that kids do like this dish. So tell us, why do you think kids are so attracted to this? Why do they like eating it?
It's a lot of different colors. Kids love colors in their food. If it looks a little bit all green, they kind of stand away from it. So you've got sweet potatoes, you've got the red peppers, you've got the green onions, you've got the lime, which kids love. So it's a very colorful meal. It's got sweet options with the sweet potatoes, so kids think it's a little bit sugary, but it's not. So it's, my kid loves it.
Well, who doesn't love sweet potatoes?
Exactly.
I mean, oh my gosh, it's almost like eating dessert, but you're not.
It really is.
So, Emily, why do you think parents love this type of dish?
I think they love it because it really can, people of any age could enjoy it. Like Mallory was saying, the beautiful colors is very kid-friendly. And then, the high fiber, the high protein. Parents are really looking for that these days. Instead of just the empty calories, the bag of chips, the sugary snacks, they're more likely to opt for something a little more wholesome in that way.
And I'll tell you, it's got to be a real struggle to be a parent these days. I mean, there's so many unhealthy, good options out there, good tasting, I meant to say, especially at school. I mean, gosh, I hate to tell you all what I used to eat when I was in high school and grade school. But can you give us some tips about how parents can maybe figure out what the good choices are for their kids in school and how to get them to steer towards those options?
Definitely. I mean, I think personally would be just trying different fruits and vegetables. If your son or daughter, they don't really like broccoli, they think it's scary, well then try, another green vegetable, or just, it's kind of like trial and error. They really don't like this, but we're gonna swap it with, let's try beets. That's a very, healthy option there as well. So
I'll tell you, the smell has anything to do with this choice. I mean, it smells delicious.
It does. Mallory, what have you created?
So we have the white ends of green onion tops and diced red bell peppers. And the only seasoning kind of flavor as far as additives that's not plant-based, it's not sweet potatoes, anything green, is the vegetable broth, which you can find at Whole Foods. It's our $3.65 everyday value brand, which is a great family budget item. You can find them all through the store. And I'm actually about to add the collard greens. So we're gonna add those and the zucchini beans. We're gonna let it sit for normally you wanna let it sit for about 10 minutes until the collard greens are a little bit wilted. And you want to cook your sweet potatoes, which we'll add last, for about 45 to 50 minutes at 400 degrees.
I'll tell you, this looks so pretty.
I know, it smells amazing.
I tell you, parents must love it too because it seems like it's super easy to make. I mean, no offense, you're working hard.
Oh no,
It looks like anyone could do this in their kitchen.
Oh, it's so easy. I'm not a master chef, and I am terrible at cooking, but this is so easy and it's delicious.
Smells great. And when you package this like at home, like if you put it in a couple of different portions, you said 5 days, it'll be good for 5 days for your kid?
Yes.
How about refrigerating? Do you need to refrigerate? Because, you know, with your lunch boxes, some of them are cool, some of them aren't cool. Some of the cool ones are the ones you can put the ice packs in and keeps it cold. Does that play in here at all?
It does not. No, if you keep it in the fridge throughout the week and you want to use it more than once, but it's a great option because you can put it in the backpack. It doesn't need to be refrigerated, and it keeps very well.
I gotcha. So how long do you stir this for?
So you want to stir it long enough for the half a cup of vegetable oil, which I just added again on top of the other one, for about 10 minutes or until your collard greens have wilted a little bit.
I gotcha. Well, looks great. And the finished dish looks like that one over there?
Yes, so we'll put this, and whenever you're done, so once that's done cooking, you'll plate it, box it up, and then you're going to add a little bit of the roasted sunflower seeds on top and a little bit of the lime juice. And then you're going to add your roasted sweet potatoes. And you can leave the peel on because the peel actually has a lot of fiber.
I was going to ask about that because I see that they're not peeled there.
Yes, so once they're done, you cut them up. You can peel them or take them off depending on if you're...
If you're a finicky kid, huh?
Exactly, exactly.
So really the nutritional value, that skin is very high?
Oh, very high. If you're peeling your potatoes, you're kind of doing yourself a disservice because there's so many nutrients and vitamins in that skin right there. So.
Wow, well, it actually looks very upscale, very delicious, and it does look very, it has a lot of eye appeal for kids. I see why they would like that. I know you brought a couple other healthy options for us. Do you want to tell us about what else you brought today?
Sure. We brought one of our prepared foods wraps and one of our prepackaged lunch or snack boxes. It's got fresh fruit. We've got some of them have cheese, some of them have turkey, ham, whichever your child is more in favor of. We've got so many different sandwiches. We've got lots of Eat Fit NOLA approved packaged items for if you're grabbing on the go, for lunch, for yourself, for your kids after school snack. Either way, there's a lot to pick from.
I'll tell you, you must be making a lot of these this time of year, huh? A lot of parents grab those?
Oh yes, and I eat them several times a week. I like them too.
So tell me about the relationship between Whole Foods Market and Eat Fit NOLA.
Definitely, yeah. So Eat Fit NOLA partnered with Whole Foods. It's definitely a growing, evolving partnership. We started doing monthly cooking demos at Whole Foods, inviting the whole community to come out, watch us create a healthy dish there, kind of like what we're doing now. And then we also do a store tour right after. We'll go to a specific aisle and kind of teach the community how, what kind of breads to look out for and what to look for at a nutrition label, at your salsa, station or something. So that's always been very fun. But recently our partnership evolved a little bit more. We have our shelf tags now. Whole Foods allowed.
I've seen those.
Yes, they allowed us to go in and pick our top 3 or 4 items of each category. So from cereal to baking to anything like that, we have our top picks of like our favorite brands, and just based on the nutrition label and the ingredient label, things that we would really recommend to people looking for more like health conscious items and things like that. So,
well, if our viewers want to know a little more about what you cooked up today, how can they find out more information?
They can visit WholeFoodsMarket.com, where we have direct links to Eat Fit NOLA's website. We also have on our websites many different Eat Fit NOLA approved recipes, as well as many Whole Foods Market recipes. And they can also find digital coupons where they can get budget-friendly items, and if they're shopping on a budget.
Thank you both so much for joining us today and bringing all this. It looks fantastic and it smells even better. So thank you.
Thank you
so much.
We'll be sharing a recipe with our viewers on our Facebook page and our website. Don't go away. We'll be right back.
Hey, Hard, what's this? That's my resignation. You're resigning. Why? You've been putting me under a lot of pressure lately. That's why I'm ready to quit. Oh, I forgot. I'll do better. Please don't quit on me.
Don't let your heart quit on you. Get your uncontrolled high blood pressure to a healthy range before it's too late.
And thank you for joining us. If you would like to suggest a health topic, send us information on your health organization's events, or recommend your favorite Eat Fit NOLA restaurant, please visit our Facebook page or email us at communityhealthheroes@gmail.com. If you'd like to learn more about our guests and share segments from our show, check out our website at communityhealthheroes.org. And you can also find our show on YouTube. We hope the information we've provided on back-to-school health tips, eye and heart health, and tasty, good-for-you lunches and snacks will help you and your family live healthier, happier, and longer lives. I'm Leslie Snedowski. Make sure to join us next time for more Community Health Heroes.